Hi everyone, welcome to Dr. Deepa's Learning Launch. I am Dr. Deepa and I'm here to present our new sessions of podcast, and now we will be starting with the general pathology sessions. So without much ado, let me go ahead and help you understand general pathology in more detail. So here we understand the complex pathology into simple, meaningful learning language, and one episode at a time, we will be breaking the general pathology into multiple videos. So stay tuned. Don't forget to like, subscribe, and share my videos with people who are appearing for NEET-SS or NEET-PG exams or FMGE exams. This will be your go-to channel. So let's start with what exactly is pathology. So what does the pathologist actually do? And what are the commonly used terms in pathology which every student should know? So let's dive in. In the segment 1, we will be first discussing what is pathology. The word pathology comes from two Greek roots, the word pathos, which means suffering, and the word logos, which means study. So pathology literally means the study of suffering. But in modern medicine, pathology has evolved far more beyond than this simple translation. Pathology is the scientific investigation which goes beyond what is wrong in the body, from the tiniest molecules to the entire organ system. So, whenever you have to think of pathology, think of three major pillars. One, the structure. What does the diseased organ look like? Then, the function, which is more to do with physiology, but there is a bit of physiology in pathology as well. How does the disease disturb the normal physiology? That is what is pathology. The cause and the effect. What does the disease start to do and what does it do to the body? In other terms, the pathologists are the detectives of the medical world, where they gather clues from the tissue, cells, and blood, and do even molecular tests to solve the puzzle of the patient's illness. What makes pathology a science? Pathology is a scientific data because it studies the structural changes that are visible abnormalities. For example, if the liver is becoming cirrhotic and nodular, what does it look like? If the kidney is shrinking due to a chronic damage, what does it look like? If a thyroid becomes enlarged and nodular, like a goiter, what does it look like? We do both. We understand both. We understand gross pathology, which means what do you see with the naked eye, and a microscopic pathology, which means what do you see under the microscope. We deal with the functional changes. This is where the physiology goes wrong. That is what is pathology. For example, in diabetes, the pancreas underproduces insulin and the blood sugar raises. That is what is the pathology of the disease. In asthma, airflow is obstructed due to hyperreactive bronchi. Then we also understand the causes and the mechanisms. A disease does not happen in isolation. Every illness has a cause. For example, is it a virus, a toxin, a genetic mutation? And what is the mechanism of the disease? How does the disease progress? What are the investigations? Pathology deep dives into investigations. We use multiple things in our array. We use histopathology, we use cytology, we use blood tests, we use float cytometry, we use genetic studies, we use immunohistochemistry. Everything comes together for a final diagnosis, which is the roadmap for the patient's management. You also have to know the essential terms in pathology, which I will explain in a simplified manner. So let's break down to some must know words that you have to know to understand pathology better. The first word is etiology, which means what is the cause or what caused the disease. For example, the dengue virus causes dengue fever. So the etiology is dengue virus. The H. pylori infection, which causes chronic gastritis, the etiology is H. pylori. The pathogenesis. What is the word pathogenesis? The pathogenesis is the story of the disease. The entire array of how it begins, how it develops, how it produces its symptoms. All of this comes under pathogenesis. For example, in rheumatoid arthritis, the immune system mistakenly attacks its own joints and causes inflammation. There is a pannus formation and joint destruction. So this whole array of the story of rheumatoid arthritis is the pathogenesis of the disease. What is morphology? The next term, the third terminology we need to discuss is morphology. Morphology is the appearance of a disease. For example, having a white patch in the oral mucosa, For example, the appearance of a cauliflower-like growth in the cervix of the female genital tract. That's a morphology. A honeycomb lung in the chronic intestinal lung disease in your autopsy that you see. That's the morphology. So morphology is what you see both grossly and microscopically. The fourth word we will understand for understanding pathology is the word lesion. The word lesion simply is an area of abnormal tissue. For example, a solitary blessed lump, that's a lesion. A dark mole on the skin, which is growing abnormally, that's a lesion. A granuloma in the tuberculosis, that's a lesion. So that's what is about lesions. The next term that we need to understand is diagnosis. What does the word diagnosis mean? This is the name we give to a disease after examining all the evidence. The symptoms, the signs, the lab tests, the imaging, the biopsy findings all put together. And this is what the patient is having. The final answer is the diagnosis. The sixth word that we would discuss and understand is prognosis. The word prognosis means the predicted outcome of a particular pathology. For example, if there is a stage 1 colon cancer, then it is understood that the prognosis is going to be excellent because you picked it up early. If it is an advanced pancreatic cancer or a liver malignancy which is advanced stage 4, then it obviously means the prognosis is poor. So prognosis basically means the predicted outcome of a particular disease. The seventh term that we would discuss is the difference between the symptom and the sign. A symptom is what the patient feels. For example, chest pain. Oh God, I have a chest pain today. That's a symptom. Oh my God, I'm tired the whole day. That's fatigue. That's a symptom. But if the doctor observes what's happening to the patient, the doctor looks at the patient who comes and says, I'm feeling tired, looks at his conjunctiva and says, oh, you're pale, then that's a sign. That's not a symptom. If it's elicited by a doctor, it's a sign. It's no longer a symptom. Symptom is what the patient tells you. The eighth term that we have to discuss in this introductory session podcast is syndrome. A syndrome is a set of signs and symptoms that can occur together. For example, Marfan syndrome, nephrotic syndrome, polycystic ovarian syndrome. So these are an array of different disorders put together as one conglomeration. That's called a syndrome. The ninth term that we discuss is an eponym. An eponym is the word that means a particular disorder is named after a person or a place as a mark of respect. For example, Graves' disease, Conn syndrome, Creutzfeldt-Jacobs disease. So these are all eponyms. So you might see your Robbins textbook multiple times mentioning the word eponym. That's what it means. The next term that we need to understand in this podcast is pathognomonic. The word pathognomonic is a telltale sign of a disease. For example, a finding that proves the diagnosis is called pathognomonic, in the sense that particular thing is not seen in any other disorder. Some examples of this is negri bodies. That's pathognomonic of rabies. You don't see negri bodies anywhere else. Or rods, seen only in AML. You don't see it anywhere else. So that is the signature notation of that particular disease. So that's the word pathognomonic. The other words that you need to understand is the word acute versus chronic. Acute is sudden in onset. Chronic is a slowly progressing, long-standing disorder. That is the difference between the word acute and chronic. For example, acute pancreatitis. It means it's a sudden onset pancreatitis. Somebody had too much of alcohol and then ended up with a tummy ache. That could be an acute pancreatitis. Versus chronic pancreatitis. It has been there for a long time. Then it's called chronic pancreatitis. The next terminology that you need to understand before you visit pathology or read up anything in pathology is benign versus malignant. Benign is a non-cancerous lesion that does not spread. Malignant is a cancerous lesion that can invade and metastasize. That is the difference between benign and malignant. The next set of words that you need to understand is the difference between the word relapse versus remission. Any disease, if it becomes quiet, then it's said to be in remission. If the disease symptoms return after a quiescent period, then it is said to relapse. For example, in any of the chronic lesions, like in case of a leukemia that is partially treated, you have given a chemotherapy, but you don't, that there is some time when the patient is doing pretty well, and then again your peripheral smear is seeing blasts. That's a relapse. If you have a patient who is having rheumatoid arthritis, you put them on steroids, you put them on disease modifying agents, and then suddenly the patient is again complaining of pain. That's a relapse. Another new terminology that we need to understand is the word remission. Suppose there is a patient who is having fever for the last couple of days, and then after a while the fever is gone. Then the fever has undergone remission. There are no symptoms right now. Now, after understanding the mandatory terminology in pathology, without which the book will not be easy to understand, we move on to understanding the subdivisions of pathology. Pathology is a huge umbrella of several branches. You need to understand the basics of what these branches mean before moving on to anything in general pathology. The first terminology we'll discuss is histopathology. Histopathology is the study of tissues. Biopsies are processed, stained, and examined under the microscope for a final diagnosis to come. This branch that deals with this particular event is called histopathology. The next branch of pathology is cytopathology, in which a cytopathologist studies the individual cells. For example, either a pap smear, a papinocola smear, or a fine needle aspiration cytology, in which the needle is put into a particular lesion, and with rhythmic movement some amount of material is sucked in the needle and then put up in a slide and examined under the microscope to help diagnose a preliminary diagnosis of an inflammation or an infection or a cancer or what have you has been made on the basis of a single needle prick. All of this is done in cytology. Then the branch called hematology, which studies the blood and the bone marrow. A beautiful branch which looks at leukemias, lymphomas, anemias, coagulation disorders, and even normal variations. That's called hematology. Another branch of pathology is autopsy pathology, in which there is the study of the body after death to determine primarily the cause of death, disease progression, or any misdiagnosis which could have caused an unknown death. Another branch of pathology is the specialized branches, which are now being done by a lot of people as a super specialty. Specialized branches include molecular pathology, immunopathology, transfusion medicine and blood banking, and chemical pathology, and even a super specialty of genetics can be done post pathology. So these are the multiple branches. Each of these specialties still share the common root of pathology, and it is diversified into multiple branches where even higher expertise is gained in the world of pathology beyond general and systemic pathology. So why does pathology even matter to you? Do you have to understand pathology? Of course you have to. Pathology matters because it is the foundation to all clinical medicine. Every clinical decision, whether it is a surgery or a chemotherapy, badly depends on the accurate pathological diagnosis. So think of pathology as the truth teller of medicine. What is the disease? How severe is it? What is the likely outcome? How is it expected to behave? And what are the next best steps are always governed by the pathological diagnosis. So thank you all for tuning in today for today's episode. And if you find this useful, please share it with your classmates, colleagues, and anyone preparing for the FMGE NEET-PG exam or is simply curious to understand pathology. So this is Dr. Deepa, and I wish you bye-bye. Good luck for your exams until we catch up in the next podcast. Please stay tuned to Dr. Deepa's Learning Launch and subscribe my videos. Bye-bye.